My guest today is David Cunic. David is a successful physical therapist and personal trainer. He's highly educated, experienced in sports medicine, orthopedics, and manual therapy. And he's worked with professional and Olympic sports teams alike. One of his unique strengths is his ability to relate to his patients, the result of undergoing physical therapy himself for several years. David is CEO of Pazoo Incorporated, which is a company focused on health, wellness, and safety. David, welcome to the show.
Thank you for having me today.
Our theme on today's show, of course, is detail orientation, which is one of the core values in my upcoming book entitled Return on Principle, which is actually coming out in September later this year. Detail orientation is a value that I don't think people really understand. Now, much of your career has been helping athletes, A-type personalities, and sports figures. So my question is, it seems to me that physical therapy is sometimes grueling, but never something where you can cut corners or skip over important or those painful parts of recovery. Can you talk just a little bit about how noticing details helped you in assessing patients' needs in the first place?
Of course, that's a great question. You talked about detail orientation, and one of the biggest things when it comes to athletes, whether it's a high school athlete, Division I athlete, or a professional athlete, is that actually everyone has a different type of personality. A lot of the type A personalities you see out there are really for the superstars. What's really interesting is that when you look at someone's personality, that's going to kind of determine how you're going to really give them the proper type of treatment plan. Overall, when you're talking to a high-level athlete, if they're bending their knee an extra 10 or 15 degrees, that could be the issue from them having pain to having no pain on really performing that activity at hand. And those are the type of details you really need to look at. You also need to take into consideration the details of the type of shoes that they're wearing, or cleat, the type of playing surface, grass versus AstroTurf. And there's all different factors. So what I always tell people is when it comes to really treating a patient and really looking at the details, it's actually looking at the overall big picture, which is sometimes we forget to do a lot. And if you look at the overall big picture and look at all the extrinsic factors as well as intrinsic factors that come into hand, it's going to get you the best treatment plan for this type of patient.
You know, it's interesting. About 4 years ago, I had a hip replacement, total hip replacement. And I was surprised because my doctor, my orthopedic surgeon, had known my background as a bodybuilder, teenage bodybuilding champion, and he knew my sense of self-discipline and detail orientation. And he told me not to even go to physical therapy. He just gave me the exercises. He said, go ahead and do them at home. I know you're going to do them to the nth most degree. And the end result is it went well. I mean, today I can go out, I can jog, and as if nothing ever happened. Is that what started this for you, is your own personal experiences as being a physical therapy patient?
Pretty much. I mean, pretty much in the grand scheme of things, I was in a major accident my freshman year of high school. I was a high-level basketball player. I shattered my leg, ended up getting 2 reconstructive knee surgeries in high school, and went to high school for a little bit actually in a wheelchair. And I am a product of a bad physical therapist. You know, I was a product of someone who didn't look at all the extrinsic factors. You know, I'm not the regular John Doe person. You know, I want to do more than just be able to walk and to be able to do activities of daily living. And I will say, David, that you are one of the few fortunate ones if you didn't go to physical therapy after your hip surgery. Because one of the biggest things we tell people all the time is, what does a surgeon do? Surgery. What does a physical therapist do? Therapy. And exactly, and in the grand scheme of things, when you're really looking at taking care of that patient and looking at those details, we tell patients all the time, you just got operated on. Even if the doctor says don't get physical therapy, come on in for a few weeks, okay? You're not an expert. When you have a problem with your taxes, what do you go to? You go to an accountant. You got a problem with the law? Where do you go to? A lawyer. You got a problem on rehabbing your body? Don't take care of it yourself. Go to your local physical therapist, get some advice, get someone else's perspective, because you know what, in the grand scheme of things, even if they only give you a few things to do, a few pointers, you want that expert advice.
So it sounds like the bad outcome that you, or less than desirable outcome that you had incurred with your knee injury wasn't because you weren't detail-oriented enough to do the work, because you were a high-level athlete at that point. But it was almost as if your physical therapist wasn't detail-oriented enough to read you as a person, to know that your desires were more than just to walk normally again, and didn't react accordingly. Is that what I'm hearing?
You're absolutely correct on that, David. And you hit the nail on the head on that. And that's really what got me first involved in this field. On top of that, going back to really looking at the details and being detail-oriented, is that here I am in high school, what do I want to be with my life? What do I want to go to college for? And it was, look at physical therapy. You have acute care, subacute care, outpatient orthopedics. You can work in a school system. You can always kind of redefine your career, but also more importantly, it's in the details. The medical field's always constantly changing. There's always new ways and better ways to kind of treat and heal the human body.
Yeah, that's a great point. I remember I had a doctor that was really good. I actually tore a bicep, and it was after I had finished my bodybuilding career. I was thinking about making a comeback, and he actually told me honestly, he says, I would not repair the tear if I were you, but if you're ever going to compete again, you better do it. And I think I had about 3 days at that point to make that decision, and I decided I was going to push it aside. I'm not going back to it. And that was an example of kind of the opposite of your experience, where the person was able to at least give me the information I needed to make the decision. And I'm sure it sounds like that's what you teach other physical therapists in your training.
Yeah, you're absolutely correct on that. And part of our medical code of ethics is to empower people with knowledge, to give them the information, okay? As a medical provider, we have to give so many different levels and so many different scenarios on what you want to do and what you don't want to do. One of the biggest things I especially tell men is it's all in moderation, okay? You need to decide what your end game is. Do you want a quick Band-Aid so you can go play in the game? That's in 2 days, but you're still going to be injured and you're still going to be hurt. Or do you want to take a step back, maybe get a surgery done, maybe do 6 to 8 weeks of therapy, so forth and so on. You need to look at all those small different details and also look at all the different scenarios to get you back to what you're comfortable with.
That's great advice. Listen, we need to take a quick break right now. We'll be right back, so stay with us. We'll have more from David right after the break, and I'm going to ask him how he can determine those athletes that are moderately successful versus those that are very successful based upon their detail orientation, because I think we can make a lot of parallels between that and being a successful investor. We'll be right back. We're back with David Cunic, CEO of Pazoo Incorporated. David, I left you to ponder a question before the break there. You know, we talk a lot about what makes a successful investor versus just maybe a middle-of-the-road investor. And one of those 7 traits is detail orientation. Tell me, when you're looking at an athlete and you're looking at their level of focus and detail orientation on physical therapy and recovery and doing all the exercises, have you found any correlation between their success as a patient and their success as an athlete? Or are those sometimes separate things?
It's kind of a trick question, and it's a trick question because it's all about the age of the patient. Okay, if this is a high school athlete who is one of the top athletes of the state or of the region, okay, what's your end game? What's your goal? What's your plan if you don't go pro? Okay, and those are the details you need to look at. Versus someone who is a Division I athlete or a professional athlete, where they're at that next stage, and then you got to ask them, okay, fine, what's your end game? Do you think you're going to play for another year, 2 years, 3 years? Are you trying to qualify for a local Olympic, for the Olympic trials? And if that doesn't work out, what's your next plan after that? And these are the considerations that people need to really think about, because if they really want to go and get to that next level, great. You know what? You need to come into physical therapy 5 days a week. You need to do your home exercises. You need to be consistent on everything that you're doing. You can't have your bad days. You got to keep keep a positive attitude and you know, stay positive and look at all the factors that goes into your long-term plan. You know, one of the biggest things I tell people all the time is come up with your short-term goals, and then you come up with your long-term goals. And you know, you mentioned about detail orientation, you mentioned investors. Same thing with investors. What's your short-term goal and what's your long-term goal? Also, look at all the extrinsic factors. Look at how the company's doing. If the company's delayed with something, was it their fault? Was it maybe an outside factor's fault that was out of their control? And that goes hand in hand with therapy and with the detail orientation. Just, you really need to look at every aspect. And one more point, David, I just want to make is that
Sure.
I always tell people that sometimes things are just out of your control, okay? And you can't get mad and you can't get frustrated, because that person or that extrinsic factor, they might have not known better. Or sometimes, you know what? Stuff happens. It is what it is. Are you going to rise up? Are you going to rise above it? Or are you going to sit here and you're going to let it knock you down? I tell all my patients, rise above it. Be the better person. Just rise above it.
Rise above it. Good advice. So, do you have a success story? I'm sure you do, about someone who was a patient or maybe a patient of one of the physical therapists that you've coached and mentored that paid attention to those details, and maybe a success story where they were doing some work at home and realized that, I'm getting, this isn't the right effect I'm supposed to be getting, and paid attention to that outcome and so on. So let's hear a good story, success story if we can.
One of my favorite success stories of all time is someone who wasn't an athlete at all. Are you familiar with the diagnosis of clubfoot at all, David?
Vaguely. So why don't you explain
so
for me and our viewers?
So clubfoot pretty much is, it happens in babies, where the foot is turned in. So you're literally walking on the outside of your foot, okay? Now they do surgeries at a very young age, within the first few years that you're born, to fix the problem. I actually had a patient, he was 20 years old, and he's been walking on the outside of his ankle for the last 20 years.
Wow.
There was a surgeon, who was a surgeon for an NFL team, I won't say which one for privacy reasons, who performed the surgery. I was very friendly with this doctor. He goes, David, because of your details, I think you can really help this patient the best. This patient drove 1 hour and 5 minutes each way to come see me. And he was coming and driving 1 hour and 5 minutes each way to come see me, only for literally a 60-minute appointment. But because he was walking the wrong way for so long, you couldn't just treat the surgical site of his ankle. You had to treat his entire leg. You had to treat his lower back. You had to treat his abdomen. You had to look at every aspect of his life. The guy has been walking the wrong way for 20 years. For 20 years, he was doing everything the wrong way. Some muscles were elongated, other ones were contracted, and you really had to look at every scenario where one day he'll come in, we focus just on the foot. Next day you come in, we're going to focus on your leg strength. Next day you come in, we're just going to do stretches and focus on your walking. And every single day you had to focus on something different.
Great.
Now, on the flip side,
okay, good. That was going to be my next question. You're one step ahead of me. I love it.
Oh, sorry. On the flip side, one of my favorite things in the world to complain to patients about is sprained ankles. People sprain their ankles and roll their ankles all the time. Women like wearing flip-flops or their high heels. Guys like wearing their sandals. Treating a sprained ankle is one of the most simplistic things in the world to take care of. But too many times people say, oh, I'll be fine, I'll do a few things at home. And they don't pay attention to those details, and then they roll their ankle again, and again, and again, and now they're having chronic foot problems. When if you sprain your ankle, if you twisted your ankle, call your local physical therapist, get it treated, even if you're only going for 4 or 5 treatments, get it taken care of, okay? At the end of the day, your feet are like tires. They need to get rotated. They need to be looked at. Same exact thing for that. So there's a lot of patients out there who've come to me after rolling their ankle 3 or 4 times or spraining their ankle, and they're just like, oh, well, it's like the 4th time I've done it. I figure about time I start getting some therapy now for it. So that's kind of a prime example of someone that doesn't pay attention to the details. And remember, you use your feet every day. You use them for the rest of your life. So why not take care of them right away?
Yeah, it's interesting because I think there are lots of ties to financial success as well as physical success. I have a couple of friends, one who had knee replacement at age 50, one who had knee replacement at age 75. The 50-year-old isn't very detail-oriented at all, and he's still kind of limping around a bit. Whereas the 75-year-old I was with last week, and he's out there dancing with all the girls on the dance floor because he followed the details of physical therapy, and he did a great job. So I really appreciate your insight today, looking at it from a medical standpoint. We're out of time, so we do have to run. But David, thank you very much. I appreciate you being here.
Thank you so much for having me. I appreciate it.
And for our viewers, stay with us. As soon as we come back, Morgan Thompson will be here for more. We'll be right back.